A great fight from inside the Champ's Vault, and joining the Champ, joining me on the show tonight, the premier dentist in all of the Eastern region, Dr. Jeffrey DeMartino. And Dr. Jeff, if you're going to fight Ernie Shavers, you better have one of your mouthpieces. And I said at the top of the show, if any moms or dads are watching, for all the high school athletes, junior high, college athletes, and pro athletes, we're going to talk about you being the premier laser dentistry. But let's talk about the Bengal Bite and the new one that you have for the women as well.
Absolutely, Mike. Thank you. Thank you for that great introduction. Appreciate everything.
You ain't seen nothing yet. You got to hear mine.
That's right. It's a knockout.
That's great. No, I'm honored to be here. I really appreciate it.
Every champion from Larry Holmes, a Lennox Lewis, a Vander Holyfield has worn your Bengal Bite. Now you have a new one out for the women. But why is it important for every athlete, young athlete, every parent watching tonight that they have? You can buy you can go to the sporting goods store, won't mention any names, for $4.50 and buy a mouthpiece. Why is it important to have a real mouthpiece?
Mike, that's a great question. I don't want to underscore the fact that any mouthpiece it will protect the teeth and help. So even a boil and bite type mouth guard for a child or for a younger athlete is great. However, a custom mouth guard provides so much more protection because it stays in place during the competition, does not move. The athlete can speak, can talk, and is not knocked out of place depending on the type of sport, whether it's hockey or football or in some cases even boxing.
Are you happy now that you are into taking care of people, teeth, and all kinds of people? Like I met your father way back in the day, 25 years or more ago, and he fixed my teeth, and I've been having no problem ever since. And then I get you, and then I have a whole lot of no. And I'm glad that I keep our relationship really going because, and I introduced a lot of fighters to you about that mouthpiece there because it's very important for you for the fighters to get the mouthpiece so they can not be hurt later on down the line.
And Doc, it's more important than even the teeth. It provides the proper protection even for football players and basketball players who may get an elbow under the boards, protection from brain injuries as well. Concussions,
yeah. Yes. True, that's a very good point. I actually came up with a design years ago. Early on, Larry used one of the first models, and it was the Bengal Bite. And it was a custom mouth guard, but it created an airway. And that's the difference between my mouthpiece and the others that were out there at the time. There's special pads in the back that protect the lower jaw. If the lower jaw fits into the upper, creates an airway, and in an impact, the lower jaw does not move. So it prevents TMJ injuries, fractures of the jaw, and of course, as you mentioned, concussions.
And we see that more and more in football and in other sports, even
absolutely.
High school level.
Yes, absolutely.
They're not doing the same mouthpiece now. They're doing it a little different now, huh? What's this Bengal Bite stuff?
The Bengal Bites, the mouthpiece basic design, it's changed over the years. I use different polymers to make it, but the basic design is the same. And we also came out with a special version just for women. I call that the Tigress line, Tigress by Bengal Bite. We've noticed over the years that women's teeth are a lot more rounded, and to obtain the same retention, I use a different type of liner within those mouth guards.
All right, and if they're interested, and believe me, you play sports, you want to protect not only the teeth, but the TMJ injuries and concussions and everything else, they can go to your website for more information?
Yes, absolutely.
You want to give that website?
Sure, yes. It's DeMartinoDental.com, and there's areas on the website that cover sports dentistry. You'll see yours truly, Larry, on our website as well.
Look at those beautiful teeth. That's DeMartinoDental.com. And let's talk about something really exciting. You are the premier dentist anywhere to do the laser dentistry. For those that don't know, what is laser dentistry?
Well, it's a great question. Laser dentistry is the catch-all phrase that they've given to dentistry that is utilizing lasers for treatment. Years ago, we were actually we were the very first in the Lehigh Valley to install a dental laser in our practice. We were the first in the state of New Jersey, in fact. But we would only do periodontal work, gum work. Was a soft tissue laser. Larry can attest to that with the gum work. It was quite an advancement at the time. And then a hard tissue laser came out, and we were the first to install it. That is it's basically a different type of laser, erbium chromium YSGG type laser, and we can drill teeth with it without Novocaine and without the use of the drill.
Say that again. Wait a minute. Let's rewind that. Okay, DVR this. You can do without a drill and without. Like painless?
That's correct. That's correct. If you feel water pulsing against the tooth, and if anything, I tell my patients you're going to feel a cold sensation, but not a heat sensation. It doesn't hurt. We do a phenomenal amount of children in the practice. My wife, Dr. Garcia DeMartino, does a lot of the children in the
happens to be
practice.
in the studio audience with us.
Yes,
She taught you
absolutely.
everything
Lovely
you know,
Nellie.
right? She taught you everything you know.
She taught me everything I know, and I'm a smart man because I realize
you
that.
learn, and you learned that.
That's exactly
You know,
right.
even the champ takes punches from Ken Norton and Ernie Shavers, but when he's in a dental chair, he likes this.
Yeah.
No pain.
That's right.
I like that. Matter of fact, guess what? You got a new patient. I'm calling you tomorrow morning. I'm going to call the office and I will be there.
I don't think he can do anything for you, really.
I'd be honored, Mike.
No,
I'd be honored.
If I see you in a chair, I'm pulling you out. I say, I'm in that chair.
I'm going to let you work on it.
I'll work on it. And
Absolutely.
also, because I happen to be on television all the time, we were talking in the green room tonight. You do something with super whitening. How does that work?
Oh, absolutely. Yes, we utilize the newest system out right now. It's called Glow Whitening, and we were the launch office actually in the Lehigh Valley for Glow. They started in Manhattan and in Dallas, Texas, and they've branched out, and we were the first to introduce it to the Lehigh Valley. It's a great treatment. If anybody out there has ever had any whitening, they can vouch for the fact that a lot of the treatments created a lot of sensitivity. In fact, my father years ago didn't really do a lot of whitening because those techniques created a lot of sensitivity. But the Glow Whitening eliminates that altogether, and it truly works. And I know patients have probably heard that, but the Glow...
How many treatments do you do for that?
It's actually a one visit in-office treatment, and there's a kit that goes home with you. It's a combination in-office take-home kit. So if you want to spruce it up and go whiter later at home, you can, or save your kit for 6 months later and use it yourself later.
So when I smile on TV next week, I'll have a whole new white smile? I like that.
I think we can do that.
I want to say hi to your mom and your dad,
I want to say hi to them.
the one
Great
who
people.
who made you.
Yeah, that's right. That's right. I've been blessed with some of the best parents a guy could ever ask for. Yeah, they're great.
And I want to mention your location. You've been there, I understand, for 58 years. Is that correct?
Yeah, that's correct. Yeah, we've been in the same building thanks to Pop. He opened the practice in 1961 when he got out of the Navy. And I think he met Larry many, many years ago. Larry was 16 or so.
Yeah, you was only a baby.
I was a baby. I don't know. I don't remember those days too well.
And that location is in Phillipsburg, Peaburg, New Jersey, and located, right across from St. Luke's Warren
Yes,
campus.
that's correct. St. Luke's Hospital, Warren campus, we're right across the street. Been in that same building. Yeah.
Cool.
Yeah,
All right, so
absolutely.
you're convenient from anywhere from Easton. That's why the Easton Assassin is there all the time, and of course from the Lehigh Valley, anywhere. It's a great thing. What are some of the? You're on the cutting edge of just about everything. If something new and it comes out, you've got it. You premiered the laser dentistry.
Yes, that's true. Yeah.
What are some of the other
Is this
things?
what
Well-
this is all about?
That's what this is all about. Yeah, it
Okay.
just was something that was in the paper years ago. My wife and I, actually my father as well, we in 1993, we went out to Salt Lake City, Utah to do training with HGM Medical Lasers to become versed in the early lasers. And we actually purchased that laser and became a teaching site, a preceptor site for the laser company. And then years later, when the hard tissue laser was invented, and came about, we were the first for that. One of the newer things we could treat root canal therapy with lasers. We sterilize the inside of the canals. Anybody that's ever had a root canal, there's many steps involved. It increases our risk for, our rate for success.
You
with
do
the
that
root canal.
before the root canal? Is that how it works?
During the treatment, during the root
during
canal.
the root canal.
Yep, during the root canal treatment. One of the other cosmetic procedures I love, one of my most favorite things to do with a laser is cosmetic gum sculpting. A lot of times I'll have a patient that wants to do a beautiful veneer case or crowns in the front, but the arches that the gums create above the neck of the teeth are not exactly ideal, and they're asymmetrical. They're not perfectly symmetrical. So I use the laser to sculpt, basically plastic surgery, if you will, for the gums above the necks of the teeth before I do the veneers. And the difference is at the end, Larry, is the difference between an okay smile and a good smile, I should say, and a wow smile. If you sculpt the gums, start from the gums and then work down.
And of course, if you're going to do it, you want that wow smile. That's the way to go.
That's right.
Champ, a lot of good experiences in the chair with Dr. DeMartino.
If you can't take the pain, don't go. No. No, I never had any problems with that. You know, you guys have been great to me, and that's why we've been together
We've been
for
good friends.
25 years, you know what I mean?
Yeah, we absolutely have.
I don't think not too many people can say that they've been with the same doctor, the same dentist for 25 years.
No, that's true. We've had a great relationship, and I truly feel blessed to be working on one of my childhood heroes that I grew up with. And of course, I became a big boxing fan myself throughout college.
And I was going to say, you have to have a big chair. The champ could sit back and on that chair, you could accommodate just about anything. But the greatest thing that I'm learning a lot tonight as well about the laser dentistry, and I liked a lot of the words you said. No pain, and explain that one more time for people that may have heard that term but don't know what it is.
It truly is no pain. Best way I could describe it is a spinning carbide drill, which a typical dentist is going to use in a handpiece, vibrates the tooth and creates heat. So you need Novocaine or something to numb that tooth so you don't feel anything. The laser does not even touch the tooth. The laser is held above the tooth. There's no vibration, which would cause heat and pain. But also another key point is that because there's no vibration, there's no microfractures that run through the enamel of the tooth. When you have a tooth drilled with a drill, there's no getting around it that you do weaken the tooth in the life of that
So
tooth.
you don't need Novocaine or anything?
No, you do
'Cause
not.
I know the shots themselves, when the dentist goes, you go, whoa, am I?
Yeah, absolutely. The shot is not a fun part. Larry is...
That's why I always miss my appointments.
If you tell me you're going to give him a shot.
That's right.
They
That's
better
right.
keep the appointments. That's what
Again,
it is.
Absolutely.
Yeah.
Yes.
So many things to talk about, and we want to give you that website again. Check it out for the mouthpieces, for the laser surgery, for more of anything that we've talked about on tonight's show. DeMartinoDental.com. For Dr. Jeffrey DeMartino, we thank you so much for being here and telling us about all the latest and
hurt me
greatest
next
in
time.
dental practices. For the former undisputed heavyweight champion of the world, Larry Holmes, I'm Mike Mittman. Champ and I'll be back inside this very ring next week, and we're going to ask, you can join us.
Absolutely.
What the heck
You get
were
those
they
teeth.
thinking?